Hello friends, in this video I will tell you about a portable suction machine and its importance for care of your patient at home. It is meant for those who have to take care of patients who are not able to swallow their own secretions or mucus because of various respiratory and neurological conditions. Secretions which are left in the tube or in the trachea could become contaminated and a chest infection could develop. So to prevent lung infection or chest infection and to maintain a good oxygen levels in your blood, the proper suctioning of oral and tracheal secretions is required. All tracheostomized patients require regular suctioning. So the secretions usually they appear white or clear, and if they start to change color, example yellow, brown or green, so this may be a sign of infection. So to prevent such kind of an infection, you need to routinely suction using a portable suction machine. So you would ask me, when should you do suction of your patient with a portable suction machine at your home? So you have to look for certain signs. Any audible or visual secretions in the tube is when you have to suction the patient. If you are suspecting a blockage or partially blocked tube because the sounds are like that and the patient is appearing visibly uncomfortable while breathing, so that is the time you have to suction using your portable suction machine. If there is inability by the patient to clear the tube by coughing out secretions, he is not able to cough out. If there is a vomiting and patient, there is a fear that patient might take that vomitus inside the chest, so then also a suctioning is required. If you are seeing a visible desaturation in the pulse oximeter, that is the oxygen level of the patient is going down, so that may be due to mucus or some secretion getting stuck in the trachea or any in the airway, which is leading to less oxygen supply to the lungs. So this can be cured or this can be resolved by doing a suctioning at a proper time. And then you can do suctioning anytime when the patient feels or hears mucus rattling in the tube or the airway. In the morning also, usually the patient has got a full chest full of secretions, because in the night usually the frequency of suctioning is less. So in the morning, when the patient first wakes up, you should do suctioning. And then when there is an increased respiratory rate, so increased respiratory rate is also a sign of distress or difficulty in breathing, so then you have to do suctioning. Suctioning should also be done before meals, before going outdoors and before going to sleep. So these are all the times when you have to do suctioning for the patient. What are the safety considerations while doing suctioning? What you should keep in mind when you are doing suctioning, so that you should not do any harm to the patient. So tracheal damage may be caused due to suctioning if it is not done properly. This can be minimized by using appropriately sized suction catheter, appropriate suction pressure, and for optimum duration. It should not be too long and it should not be too less in the duration. The pressure setting of the tracheal suction is usually between 80 to 120 mm of mercury. To avoid tracheal damage, the suction pressure setting should not exceed 120 mm of mercury. For pediatric patients, usually it is done, the pressure should be 50 to 75 mm of mercury, and for adults the pressure range can be 80 to 120 mm of mercury. Each episode of suctioning includes passing the catheter and suctioning the tracheostomy tube. So this should be completed within 5 to 10 seconds. So you should not keep the tube for too long a duration inside the trachea. So you have to repeat this process 2 to 3 times until the trachea and the airway, the upper airway, is cleared of its secretions. what are the equipments which are required while doing suctioning? So first and foremost, you should have portable suction machine besides your bed ready, plugged in, and all the tubings connected. You should have clean suction catheter. You should have sterile normal saline, ambu bag, one person to help you out, and then suction canister and suction tubing. So these are the items which are required when you are doing suction for your patient. So how to suction using a portable suction machine? First and foremost, you have to gather all the supplies. Then you have to wash your hands. Wear a disposable clean glove in your hand. Check for the portable suction equipment and make sure all tubing connections and collection jar are having tight seal. Place the portable suction machine on a flat, dry and safe surface and plug the suction machine to an electrical outlet and turn it on. Set the suction pressure. Check the pressure by turning the machine on and covering the opening end of the suction line with one hand. Pick up a clean suction catheter. Then once you have checked all the gear, then you have to put on the gloves. Connect the tubing to the suction catheter and place the catheter into the tracheal tube, and be careful not to let it touch anything before it enters the opening of the tracheal tube, so that you should not put any infection from outside with the tracheal tube inside the trachea. Slowly you have to move the catheter down into the trachea until resistance is felt, but once the resistance is felt, you should not force the catheter down. Cover the suction port with your thumb and slowly pull the suction catheter up and out. Do not leave the suction catheter in the trachea for more than 10 seconds. Repeat this process 2 to 3 times until the secretions are gone. Then once you are done, disconnect the catheter from the suction tubing and set it aside for washing. Rinse the suction tubing with normal saline until it is cleared of mucus, and shut off the suction unit and remove your gloves and wash your hands. So this is how we do suction of a patient. What are the features of an ideal portable suction machine for home use? So it should be automatic, it should be lightweight, it should be oil free, piston pumps should be there for zero maintenance. It should have easy to read vacuum gauges with precise vacuum adjustable knobs, and then there should be suction of at least 300 millimeters of mercury with a flow rate of 30 liters per minute. So this is the maximum which it should have. Anything between 150 to 200 is also fine, because ultimately the suction what you will be actually using will be not more than 120 millimeters of mercury. The glass jars, the capacity of glass jars, the more it is, the better. So you'll have to clean it less often during the course of the day. So a glass jar of 2.5 liters each provide ample capacity to hold the secretion to allow for once a day disposable. Maximum free airflow rate of 15 to 20 liters per minute should be there. Noise of less than 60 decibel. Voltage of AC 220 and 50 Hz. And reservoir volume of home portable suction, if it is 1 to 2 liters, it is enough. Warranty of 1 to 3 years is good enough, and you should have vacuum meter or vacuum regulator. Next, I'll be telling you few portable suction machines in India which are good enough and which are available on Amazon. So I'll be posting the links of these portable suction machine in the description of this video. You can go and check them out. And if you have any other questions regarding portable suction machine, you can post them here, and I'll try to answer all of them. And please subscribe to this channel and like this video